Trizetto is a healthcare solutions technology provider, and I'm sitting here now with Kathleen Neben, who's a product manager there. Kathleen, thank you so much for being here.
You're welcome.
There's been a lot of buzz at this conference about value-based benefits design. First, let's break that down. What is it exactly that you're referring to?
Well, it's the ability to design a health insurance product for a member that really addresses what their specific needs are, and also tends to include components that will provide incentives like cash and gift cards, and also modification in their out-of-pocket cost sharing based on them doing particular desired activities that benefit their health, whether it be health and wellness activities like getting preventative visits or screenings, participation in those kind of programs. Then they might have lower out-of-pocket cost sharing for those. Also, a lot of employers now are looking for outcomes-based incentives to say, we're going to measure your cholesterol level and look at your BMI, and if you're within targeted ranges and you've achieved the outcome that you as an individual can do, then we will reward you for that, whether it's again cash or maybe a reduction in your premium contribution that you make for your health. Okay. So that's the health and wellness side. And then on the chronic disease side, if you have, say, diabetes or asthma, programs that really lower your out-of-pocket costs for the maintenance medications and visits to the doctor, tests, those kind of things that can help you keep you healthy, and also providing incentives for people to participate in education programs and other things so they can keep their health status high and hopefully prevent secondary conditions or hospitalizations, that type of thing. That's really what that means.
And it really seems like there's a lot of moving parts there too, really finding out what people want and would motivate them to have good behavior, and so they'll be rewarded in the end. I mean, so a lot of research goes into this.
Yeah, it's really important to have an effective design to understand the population to whom you're offering it to. So to analyze what chronic conditions are of particular interest to that population, and also to understand really what the employer and the employee's needs are. Engagement is very important.
And what are some of the biggest challenges, though, that benefits managers really need to be up for in implementing these kinds of designs?
It's all about member engagement. So it's about meeting the member where they are. And at this conference, there's been a lot of talk about that. I mean, what's it going to take to get somebody to modify their lifestyle, to be more healthy? And just barking at them to do the right thing, isn't very effective, especially if you have kids. You've seen that never works, right?
Yeah.
So, looking at what it would take to help them, and also from the insurance company perspective, to the extent that you can align value-based benefits with value-based provider reimbursement so the doctors and the patients have the same incentives and alignment is very important.
On the surface, it seems like giving cash, gift cards, all of that seems like a great thing. Do people respond to that in general?
Yeah, they do. One of the things, though, that if you study behavioral economics, there needs to be kind of two levels of incentive. So one of the things that we want to do is lower the out-of-pocket costs for key services so that people will get that medical service. But however, that may not be an incentive at the point in time, you know what I mean? So frequently now we enable a combination of giving a short-term reward with a longer-term reward so that they'll obtain the services that are needed.
How long does it take to implement some of Trizetto's designs?
Well, what we've done is we've integrated this value-based benefits solution for our payer customers with our core claims administration systems, which is important because that's where we access eligibility information for the member, and we real-time communicate between the VEB solution and the claim system to say, Mabel's done the desired activity, so her benefits are lower. So the implementation of that is not too bad. I'd say probably to get everything installed and up and running, about maybe a month.
Okay.
What tends to take the longest is really the insurance company understanding what designs they want to offer, and there's a lot of business process impacts throughout the entire payer line of business with customer service and operations and sales, etc.
Has the reaction from the payer market been good?
Yeah, I think payers are really interested in what they can do, obviously, to lower costs. There are some complexities and around, again, the operational impacts, as well as things need to be more automated, and that's what we're working on, because you want to make sure that you don't design programs that are so complex that the cost of administering them offsets the benefit. Sure. So there's a little evaluation. A lot of these designs have been pretty more aggressively adopted by self-insured employers, large employers that look out over the lifetime of their employee.
Right.
And now we're beginning to see slowly more payers looking at how they can use these products for the insured market.
Have you found that you've had to be even more innovative now that since reform was enacted, people are looking for solutions and being much more motivated to come up with creative solutions for their workplace?
Yeah, I mean, I think healthcare reform in two ways has driven more interest in these products. One is that value-based insurance design is in fact directly referenced in healthcare reform law, and also because payers are looking for ways to keep their medical loss ratio within guidelines, as well as the final thing, which is that the recommendations for what could be included as medical expenses in the calculation of that medical loss ratio. A lot of these health and wellness type activities and incentives associated with them, as well as some of the IT costs associated with their implementation, may be included. So that's really made payers want to stand up and say, we need to do this.
Cool. All right. Well, thank you so much, Kathleen.
Thanks.
Is there anything that I've missed about your programs?
So. I don't think so. All right. Thanks.
You're watching continuing coverage of the World Healthcare Congress in Washington, D.C.